Hello. The conference will begin soon. We're just gonna wait for one of the guest speakers.
Hello.
Hello.
We cannot hear you.
Okay.
Now we can hear you.
Are you able to hear me?
Yes, honey. Is this Neela?
This is Natasha.
Oh, Natasha. I'm sorry.
That's okay. Can you hear me?
We can hear you.
Hello?
Yes. Hello.
Hello, everyone. My name is Kaylee Chun, and I am the Outreach Director at Aspiring Doctors. Welcome to our Dental Careers Conference. If you haven't already, for the audience, please turn off your camera and microphone. So now I would like to welcome our guest speakers. First, we have Dr. Kavita Rowe. Next, we have Dr. Jordan Verdin. Next, we have Dr. Anwar. And lastly, but not least, we have Dr. Natasha Bala. If our guest doctors would please like to briefly introduce yourselves, that would be much appreciated. And you could go in any order.
I'll go first. Can you guys hear me okay? All right, I'm Kavita. I am a general dentist. I practice in Seattle, Washington. I'm originally from California, did dental school and undergrad through the UC system, undergrad at UC Berkeley, dental school at UCLA, and then moved up to Seattle to do a one-year residency program at UW. And I've been practicing in Seattle for about 5 years now.
Hi, I'm Jordan. I'm the pediatric dentist. I'm from Baltimore, Maryland. I did my dental degree at University of Maryland as well as my pediatric dental certificate. And I graduated in 2019. So just had my first year of working, which was kind of interesting with COVID. So thanks for having me, and I'm excited to be here.
Hi, everyone. I'm Dr. Anwar. I'm the orthodontist. I was born in San Diego, California, pretty much grew up in Southern California my whole life. For my undergrad, I went to California State University, San Marcos, so that's north of San Diego. And then I went to USC for dental school in Los Angeles. And then for my ortho residency, I went to University of Rochester in upstate New York. And now I'm working in Buffalo, New York as an orthodontist. So I'm happy to be here.
Hello everyone, my name is Natasha Bala. I'm a permanent oral and maxillofacial resident in New York. I was born and raised in Dubai, moved to Canada, which is where I completed my dental education, and now I'm doing my residency in New York. I have a couple more years to go, so yeah, that's basically about me.
Okay, thank you so much for introducing yourselves. Before we begin, I would like to thank our doctors for taking time out of their busy day to be here with us. Thank you so much. So let's begin. The first set of questions are for our general dentist, Dr. Kavita Rowe. So for the first question, how did you become a general dentist?
Yeah, so I followed a pretty typical path to becoming a general dentist. I did 4 years of undergrad. Like I said, that was at UC Berkeley, and I was a science major. They majored in molecular environmental biology, which was great because that pretty much covered all my prerequisites for dental school. That being said, you really can major in anything that you want as long as you take the required prerequisites for dental school. But for me, that worked out well. I graduated a semester early, and then I actually took a gap year, which ended up being a year and a half. And then I, during that time, was applying to dental school, taking the DAT, and then I did dental school, 4 years of dental school. As part of that, I did, you take the NBDE, which is the national boards. There's 2 parts to that. Those are the written exams. So I did that while I was in school. And then I chose to do an optional 1-year residency program, which is not required, but I wanted to get more training. So I did a hospital-based program, and that's what brought me up to Seattle. So that was pretty much my training. That was my path to becoming a general dentist.
Thank you so much for your response. The second question is, what was the process of applying to dental school like?
Yeah, so applying to dental school, as most of you probably know, it's on rolling admissions. So the earlier you apply, the better. I applied pretty broadly to about 15 schools across the country. And since it's rolling admissions, of course, the earlier you apply, the better your chances are. So I really encourage you guys to try and have your application materials ready as early as possible in the process. So that means if you're wanting to go straight from college to dental school, you're going to be applying the summer before you finished your last year of school, which is really early to have everything ready. So for me, I took a gap year, and that worked out really well for me. And I know a lot of my classmates in dental school took at least 1 year off. So that worked out well for me. You want to make sure, because it's rolling admissions, if you can have ready to go in, is it June? I can't remember, June or July. It's been like 10 years now since I applied, but right when applications open, if you have already asked your recommendation letter writers, that's super helpful. You want to make sure you give them plenty of notice. Have most of your prereqs done. It's okay to still be taking some of your prereqs during the application process. You want to make sure that you have a DAT score you're happy with. That's the really hard one. And maybe even a draft of your personal statement. So that way you can apply as soon as applications open, and you'll maximize your chances of getting into dental school.
Thank you so much. The third question is, what does your typical day look like, pre-COVID and present?
Yeah, so a typical day for me, let's see, we start really early at my office. So I come into the office about 6:45 for morning huddle. And I work in a pretty big office, so we have 3 full-time doctors and 6 hygienists. So morning huddle is really the one time that we can all really connect and make sure that we're on the same page. We know kind of how the day is going to flow, especially if there's any patients who are going to be seeing hygiene as well as a doctor. We call those crossover patients. We want to make sure that we know where they're going to be and how the day is going to flow. So that's our morning meeting, 6:45. Our first patient is at 7. You might think that's really early, but especially in Seattle, we've got a lot of young professionals, and a lot of patients want to come in before their workday and not have it interfere with their work. So the 7 a.m. is a really popular appointment. A little bit early for my taste. I'm not a morning person by nature, but it's really nice to finish early. So we see our first patient at 7. We're pretty much back to back until about noon. We take a lunch. I run a 2-column schedule, so that means I have 2 patients in the chair at a time, and that's not including the patients who are scheduled for their cleanings. So I might go in and get a patient numb and then go do an exam for another patient, come back and prep a cavity for a filling, go seat a crown in the other room, and then while I'm not with my patient, my dental assistant will be doing something with them. So it is really busy. We try and shoot for a 1-hour lunch. That doesn't always happen. You know, you're working on patients. So if you are running behind, you know, maybe a patient showed up late and then they had to go to the bathroom and then you couldn't get them numb. They had a really hard time getting numb. So of course, you know, you stay with your patient until you're done with everything. So most of the time I'm really big on breaks. I like to make sure that we get our breaks. But there, of course, have been days when we work through lunch or part of lunch. And then we finish around 4 p.m. I stay usually about 30 minutes or so to finish up my chart notes, and then I'm pretty much done with my day.
Okay, thank you so much for that response. The 4th question is, why and when did you decide to become a general dentist?
Yeah, so I always wanted to do something in healthcare. I thought I wanted to go the medical route for the longest time, and that was mostly because I didn't really explore the other health professions very much. When I got to college, I actually I took the MCAT. I had pretty much everything ready to go to apply to medical school, and when I was writing my personal statement, I was like, you know, I don't think I ever really reassessed that this was the right path for me. I was also doing a surgery internship at the time, which was really cool. I got to shadow residents in different surgical specialties, and I realized I really liked the hands-on approach, kind of having the ability to take a patient out of pain pretty immediately. But the lifestyle just wasn't for me. A lot of the residents were kind of at the age where they were starting families and just not able to be there at home for their, you know, new kids. And I was like, I've always wanted to have a family, and that was really important to me. So I kind of reassessed and looked at a bunch of different professions, both in and out of healthcare. And ultimately I realized that it was still really important to me. I think health is something that's so crucial to a person's quality of life and happiness. And I really wanted to be able to help patients with their health. Why general dentistry in particular? I love that we get to design something that's not only functional, but also aesthetic. So it really does combine your artistic side and creative side with the sciences, which is awesome. And in general dentistry, for me, it's about the relationships. So I get to see 1-year-olds for their first ever dental visit, all the way up to 90-something-year-olds. And I love that I get to build relationships with people and see them progress over, you know, the course of their lives. And it's a fun aspect of it, but it's also really challenging. You know, especially in a busy day, you have maybe like a minute to get to a patient to really like you and trust you before you go and look inside their mouth, which is a really intimate part of the body for most people. So yeah, I think it's challenging and it's fun, and yeah, the relationships really make it for me.
Thank you so much, Dr. Kavita Rowe, for your insightful responses. We really appreciated them.
Yeah.
So now the second set of questions are for our pediatric dentist, Dr. Jordan Verdon. The first question is, how do you become a pediatric dentist?
Sure. So the way that you become a pediatric dentist is you, of course, do your 4 years of undergrad, and then you do 4 years of dentistry, and then the pediatric residency is typically 2 years. I would say for pediatric dentistry, if you're interested in it, to try to get those experiences in dental school, whether it's hanging out in the pediatric dentistry department, or if you have a local dentist who maybe was your childhood dentist and spending some time with them, just to get those experiences. Because when you go to apply for pediatric dentistry, I think at least what I found for the application process is a lot of the reviewers will look and see kind of what your community experience is, you know, if you're a team player, if you were involved in, you know, organizations or clubs during dental school, and kind of what your passion for pediatric dentistry is. And so then you would apply. It's through the match process. So you go on interviews, and then you rank kind of the programs that you would like to go to, and then they rank you, and then somehow a computer system figures it all out. And then that's where you go, and then you spend 2 years in residency learning about child behavior, child psychology, sedation, restorative work on children, and getting to see a lot of children, especially those children who have special health care needs. Because I think that's something really cool about pediatric dentistry is we see a lot of patients from when they're very little to adulthood that do have special health care needs. So that's kind of in a nutshell, very briefly, how you become a pediatric dentist.
Thank you so much for your response. So the second question is, what does your typical day look like pre-COVID and present?
Sure. So pre-COVID, I would say main differences from pre-COVID till now is we have, you know, the masks, we wear face shield, we wear longer coats that we change after each patient. We have barriers, sneeze guards up. We have different things for disinfecting, things like that. And our schedule is a little bit later. But a typical day in our office, we have our morning huddle around 7:30, 7:45, and then we start our first patients at 8. We do oral sedation daily at 9 a.m. only. So if we do have an oral sedation patient, we'll see that patient at that time. Typically, we'll see patients for fillings, stainless steel crowns, extractions in the morning, just because we find kids are a little bit fresher in the morning. So behavior-wise, that's something that we like to think about. We like to keep all of our restorative and little ones in the morning, just because it's not around nap time. And then the afternoon, we'll see more of our teen and preteen patients. So we have one column full of restorative from 8 until about 1, and then we have a break for lunch. And then in the afternoon, it's typically only hygiene patients, and we do some of our own hygiene as well as having hygienists. So typically we'll go from 8 till 1, and then from 2 until about 5. And then the other thing that we have is on call. So each week a different doctor is on call. So if we have a child that has a fall, during COVID, we had a lot of bike accidents and lacrosse stick accidents. So we always have someone on call to answer those emergencies for our patients. But that would be a typical day for us.
Thank you so much again. The fourth question is, what are 3 things that excite you about being a pediatric dentist?
Sure. So the first thing is I think it's really great that pediatric dentists, through working with children, have the opportunity to influence a whole family. You know, I find parents are much more willing to make positive changes for their child than they are for themselves, just because parents want their children to have the best life. So when we talk about diet recommendations or home care, you know, the changes that we recommend for the child can also have positive benefits for the family. For example, just this week we were talking about getting rid of gummy candies for a patient because she kept ripping her space maintainer out, and the family as a whole got them out, and now they're trying to incorporate other foods. The second thing I would say is just working with children in general. They say the funniest things. They'll tell you all kinds of crazy things about, you know, probably things they shouldn't even be saying. Like I have one patient who was telling me about her dad and how he uses the same floss for like multiple days, and the dad was like beet red in the face. So it's just the things that they say, and hanging out with kids all day I think is really rewarding. And then getting to work with a lot of kids and a lot of patients, especially medically compromised patients and patients with special healthcare needs, because we also do, in addition to our office work, have privileges at the hospital to take kids to the hospital for hospital dentistry. So I think that's really interesting and a really great service that as pediatric dentists we can provide to our patients.
Thank you so much. That was a great response. So the last question is, what is the most challenging part as a pediatric dentist?
I think the most challenging part of being a pediatric dentist is tailoring each of your kind of treatments and what works best for each individual child, because there's not one cookie cutter way for treating children in the dental environment. So trying to keep up with research to make sure that you're constantly up to date on the latest pediatric dental treatments for kids, so you can tailor treatments that way. And also looking at each child as an individual and kind of thinking what would work best for each child. I think it's something that's really challenging, but also really, really rewarding when you figure out kind of what the secret sauce is for each child and get them comfortable. Because I think at the end of the day, pediatric dentists help set patients up for a lifetime of good oral health. And so that's something that I think is challenging, but also something very, very rewarding.
Thank you so much, Dr. Jordan Verdon, for sharing your amazing responses. We really appreciated it. So the next set of questions are for our orthodontist, Dr. Anwar. So the first question is, what does an orthodontist specialize in?
Yeah, so as an orthodontist, so not only
You know what?
align or
Okay.
straighten, but we also deal with kind of misaligned bites and jaws. So the specialty is actually titled Orthodontics and Dentofacial Orthopedics. So as far as the dentofacial orthopedics part, so we help with guiding facial growth and facial development during childhood. And in adults, we actually can help the oral surgeon with those who undergo jaw surgery and make sure everything's properly in line before they go through surgery and after surgery. So everyone here, knows us to be the ones to put on the braces, but we kind of do a lot more than just that. So that's kind of what we do in a nutshell.
Thank you so much. The second question is, how do you become an orthodontist?
Yeah, so kind of what Dr. Rowe and Dr. Verdon touched on, but to become an orthodontist, so you go to college for 4 years, complete the prerequisites, so the bio courses, the chemistry courses. You could major in something else other than the sciences, but as long as you complete those, you should be fine. And then you go to 4 years of dental school and complete, obviously, the required board exams and the clinical requirements. And then you do ortho residency. So that can be 2 to 3 years. Each program is different. So some are 2 years, some are 2.5, some are 3 years, but they're all the same pretty much. And then you do your board exams and get all the good clinical experience there. So then you can work as a specialized orthodontist.
Thank you for that response. The next question is, what are 3 things that excite you about being an orthodontist?
Yeah, so the first thing I would say is just being able to increase somebody's self-confidence, and their self-esteem is just so gratifying. Once we take our patients' braces off, you just see them beaming and just so happy. You see their whole personality just change almost. And we have patients that come in who are bullied or are super self-conscious. So just this profession is wonderful in that regards because you can totally change their whole life around. And then the second reason, second thing that excites me is just building the everlasting relationships with our patients. We see them pretty much every 6 to 8 weeks. So you really get to know the patient and their family, and you get to see them grow and mature. So that's really great. And then typically somebody's ortho treatment can be like 1.5 to 2 years is on average. So you really get to know them during that span of time. And then the third thing I would say is the lifestyle as an orthodontist. It is really wonderful because you have a lot of flexibility with your schedule and you don't really need to work 5 full days to be successful per se, especially if you own your own office. So as a practice owner, you can be open 4 days a week, 3 days a week, and still do really well. So you have a lot of time to do things you enjoy aside from work. Also, it's not strenuous on your body. So you have assistants who do most of your procedures, like changing the wires, the elastic ties, removing the brackets, taking records, so the photos. So your assistants play a really big role. And pretty much as an orthodontist, it's nice because you just go from chair to chair, do what you really love the most. So the diagnosing, the treatment planning, the talking to patients. And then lastly, orthodontics is not very stressful. So there's no blood really, there's no shots, anesthesia. So it's very clean. It's a very clean profession. Also, people don't come in very scared, which is nice. They typically are excited or like nervous to get their braces on. So they don't come in very fearful, which is great.
Thank you so much for that great response. The last question is, what does your typical day look like pre-COVID and present?
Yeah, so I actually work with my husband. He's also an orthodontist. I met him, he was a year ahead of me in residency. So we both work in a large pediatric practice. We are 2 of the 3 orthodontists there. And typically we see like 50 to 75 patients a day. In the mornings, we have bondings, which means those are the appointments with putting braces on. And then in between, pretty much throughout the day and in the afternoon, we have the adjustments. So those are like the wire changes. We have retainer checks. We have new patient consults. And then we have debond appointments, which means those are the appointments where we take the braces off. So that's pretty much like a typical day. And then pre-COVID to present, the big difference is just all of the PPE, which means like all the protection that we wear. So gowns, face shields, we wear like footies. So that's pretty much the big difference with that. And then I work 4 days a week. So I'm off Fridays, which is really nice right now. And we're both working as associates in this practice.
Thank you so much for those amazing responses, Dr. Anwar. We really appreciated them. The next set of questions are for our oral and maxillofacial surgeon, Dr. Natasha Bala. The first question is, what is an oral and maxillofacial surgeon?
Okay, sure. So basically an oral and maxillofacial surgeon is trained so that we are specialists of everything clavicle, basically this area up until here, your forehead region. So some of the things that you can kind of do as an OMFS is you can do wisdom teeth extractions, you can do dental implants, which is what about 95% of all OMFS end up doing. But in addition to that, you can also treat facial trauma. So, a patient gets into a bike accident, they end up breaking their nose, or they end up fracturing the bone that's under their eye, they end up fracturing their forehead. All of those fractures need repair, and that's something that's repaired in an operating room. And you can do that once you've graduated from OMFS residency, because that's something that we train for. Other things that you can also do is that patients can end up having pathologies of their, somewhere along their face. That pathology could be something just related to the skin. That pathology could be something that's related to the bone. It needs to be removed. It needs to be treated. That pathology could be something that's not terrible, which means that once it's been treated, it's likely not going to happen again. Or that pathology could be cancer, which means that you're going to have to monitor that patient for a very long time. So that's another thing that OMFS is trained for. That is something, though, if you specifically want to treat cancer, you need additional training after being done residency. We also do a lot of cosmetic procedures, so things like fillers, blephs, other facial procedures. We can do all of that as well. And I'm trying to think, what else can we do? We can do orthognathic surgery. So just as our previous orthodontist just talked about, they tend to align the teeth for patients who eventually would need orthognathic surgery. So orthognathic surgery is something where a patient's lower jaw is not aligned with their upper jaw. Either the lower jaw is really far pushed back or it's really forward, and that can actually affect how patients eat, how patients look, how patients feel about themselves. I've had a lot of my patients tell me that, my friends at school make fun of me because my lower jaw is really, really far forward and it makes me look funny. And, these patients are 12 years old or 13 years old at a time when their confidence levels are being affected, their self-esteem is being affected. So something like that, we should definitely be able to treat it. So you can actually do surgery where you can move the lower jaw further forward or further backward, or you can do the same with the upper jaw. So, those are some of the things that an OMFS can do. You have two options once you've graduated from residency. You can either work in a hospital and you get to do these bigger procedures, the operating room procedures where you treat trauma or cancer, or you do, orthognathic surgery, or you could work in a clinic, kind of one that you would find, anywhere in your town. And those are the patients over there who will go to have their wisdom teeth extractions or have implants placed or other procedures that need to be done in their mouth. Those procedures can also be done while the patient's awake, or they can be done while you're being put to sleep, and that's also something that an OMFS is trained for. Or the last alternative is that you can do a mix of both. So a couple days during the week you can work in a hospital, and a couple days a week you can work in a clinic, private practice setting. So that's kind of a brief overview of what we do as OMFS.
Thank you so much for that wonderful and detailed response. The second question is, what is the process of becoming an oral and maxillofacial surgeon?
Very similar to all of our previous guests over there, who've talked about, you do first end up going to dental school. So one might wonder that when you're treating all of these facial procedures, why do you need to go to dental school before, doing all of that? Why not medical school? So when you are treating facial trauma, for example, let's pretend that a patient has broken their lower jaw or a patient has broken their upper jaw. What's going to determine where you actually end up fixing their jaw is very dependent on teeth. So we actually use where a patient's teeth come together, and that's the framework for how we end up fixing their jaw. So it is important in that sort of a situation for you to know, dentistry prior to actually doing OMFS, or obviously wisdom teeth extractions and implants and other procedures that you can do in the mouth that, of course, a dentist would be best apt at learning or doing something like that. Also, things like orthognathic surgery, you have to know how a patient's teeth come together, because that's also one of the things that you are going to use as a framework in order to decide where you're going to move their jaw eventually. So, for that reason, OMFS goes to dental school before they actually start OMFS residency. However, within OMFS residency, a large part of my residency currently is involved with, the medicine departments of our hospital, because if you are taking a patient to the operating room, your patient is being put to sleep, that patient is your responsibility. You need to know not only just what's going on with their surgery, you also need to know what's going on with the part where they're being put to sleep. So that's a part of my training in residency, where I receive anesthesia training. I learn how patients are put to sleep, how to do that safely, how to make sure that they're doing okay. Another thing that I'm going to go the process of becoming an OMFS. You go to dental school. In order to apply for OMFS, you have to write a standardized exam. It's called the CBSE, USMLE Step 1, whatever you want to call it. And it's essentially the same exam that medical school students give in order to get into residency. It's just one of the many exams that they write, but that's something that we are required to study for. It's a little bit harder to do it when you're applying for OMFS residency, because a lot of the things that you're tested on in the CBSE, we've never actually learned it. So it involves a lot of self-learning, so it is a difficult exam. But that's the stuff that you're going to learn once you are in residency. So it is important to know it, except you're just learning it before you actually end up applying. So that's one of the things that you require. Of course, most residencies prefer that your rank in your class is somewhere between the top 10 and 15%. That's not to say that people who are not in the top 10 or 15% of their class don't make it into OMFS. It might just be a little bit more of a challenging route. In addition, they look for things like, what kind of extracurriculars were you involved with? Do you know what OMFS is about? Have you visited any OMFS residencies in order to see if you actually like OMFS and you're ready to commit the next 4 to 6 years of your life to it? You usually apply for OMFS residency somewhere in your 3rd or 4th year of dental school. That's not to say that people who don't graduate from dental school don't apply for residencies. I started my residency or even applied well after I graduated from dental school. So that's something you can also do later if you realize that it's something you want to do. And yeah, that's basically the process. In terms of actual OMFS residency, you can either apply to a 4-year program or a 6-year program. There's a few differences between that. And there's one central application to which you apply for OMFS. So you can apply to many schools with the same application. And you have to do an interview, of course, and that's kind of a very brief overview of how you can become an OMFS.
Thank you so much for sharing. The next question is, how are medicine and dentistry incorporated into what an oral and maxillofacial surgeon does?
So kind of similar to what I was talking about before, my residency comprises of about 2 to 4 months where I rotate through the internal medicine department. So the reason I do that is because a lot of my patients have medical conditions. They'll have diabetes, hypertension, they might have some kind of autoimmune disease. So if I'm going to be doing surgery on these patients, I have to know that it's safe for me to do surgery on these patients, that they are, as medically optimized as they can be in order for me to do surgery. Yes, of course, I can always rely on their medical doctor to give me that answer, but if I'm responsible for this patient, I also myself want to know that the best decision is being made for this patient. So that's one of the ways that medicine is incorporated into OMFS. A lot of our patients are medically compromised, so we do need to know about their medical conditions. The other way that medicine is also incorporated into OMFS is that, like I said before, we have to learn about anesthesia. So our anesthesia training in our residency is somewhere between 5 and 8 months. During that process, we learn how to put patients to sleep, we intubate patients. We don't do this necessarily for OMFS patients. We might do it for an orthopedic surgery patient. We might do this for general surgery patients. It's anyone who goes to the operating room, we need to know how to manage them. And that's why it takes about 5 to 8 months to learn how to do that. We also learn something called conscious sedation. So basically what that is that it's not entirely putting a patient to sleep. It's sort of, getting them to be a little bit more relaxed, a little bit more sedated, but they're breathing on their own. And we learn how to do that for our patients as well. The reason that we learn how to do that is because in private practice, maybe some of you have had your wisdom teeth taken out and you might have been put to sleep to do something like that. And it can be a challenging procedure. So being able to keep patients a little bit sedated while doing that is helpful. And so we also have to learn how to do that. OMFS does their own sedations. A part of our residency also is that we go through general surgery. So we learn how to, medically manage patients who are on general surgery. We learn about many different general surgery procedures. So basically everything neck down. And we spend somewhere between 5 months to about a year on that service. And that's kind of the medicine part of OMFS. And then, as I mentioned before, the dentistry part is that when you're trying to fix a patient's jaw, how their teeth come together is basically determines where you're going to fix their jaw, same with orthognathic surgery. And there's a lot of dental procedures, surgical dental procedures as an OMFS that you can do. And that's where all of your dentistry comes into play again. And, for someone who, if you've enjoyed dentistry, but at the same time, you also still really like medicine, I think OMFS is a really great way to mix both of them. I like using my hands. That's why I can't imagine that I would if I were to pursue a career, that I would just be able to do internal medicine, because I actually like doing procedures. So that's why, OMFS works for me, because we get to do procedures, but then also we have to think about the medicine behind things. And that's basically it.
Great, thank you so much for sharing. Our last question is, what does your typical day look like pre-COVID and present?
I would say that, my residency has actually not really changed with COVID. I mean, yeah, definitely I have to wear an N95 all the time. Then I wear a mask on top of that. I wear a face shield as well. I also wear my glasses as well underneath the face shield. We wear gowns all the time. We switch it between patients. All of that. Agreed. It's, we're definitely doing all of that. But just the way my residencies worked out, they have not slowed the number of patients down that they're seeing. We're seeing just as many patients as we were seeing before. I think a lot of patients are actually, for elective procedures, a lot of patients are actually home right now. They're not going to work. They're working from home. So they're a little bit more flexible with their schedules. So the number of procedures that we did between July and October was about 3 times the amount that we were doing last year. And I'm just talking about elective procedures right now. So, patients are, at least in New York, they are coming into the hospitals and they're not feeling super uncomfortable doing that by any means, at least in my hospital. And definitely other procedures have gone down. So things like trauma, thankfully, so it is down. So we're not seeing as many facial trauma cases. That's one difference. And again, pre-COVID and present, my day usually starts with me waking up somewhere between 4 a.m. and 5 a.m. I usually have to be at the hospital by about 6 or 6:30. The reason that I have to do that is oftentimes we're actually seeing some patients who are admitted to the hospital. Maybe somebody fractured their jaw, or maybe somebody has cancer. Maybe they're receiving orthognathic surgery, so they're actually admitted to the hospital, and we're required to go see them in the morning as a team to make sure that they're doing well and getting updates on them. So that's something that's usually done around 6 or 6:30 in the morning. After that, usually the team disperses into a few different directions. The next thing that happens is the operating room starts around 7:30 in the morning. So whatever patients need to be operated on, a few residents are going to go and take care of that. And usually clinic will start around 8 a.m. or 8:30, and that's where we do a lot of our wisdom teeth extractions, emergency patients, dental implants, etc., sedation patients. So a bunch of people will head to clinic. Patients who spend time in the operating room, usually we finish our operating room days anywhere between 4 p.m. and maybe 7 or 8 p.m. Clinic is usually done by about 5 p.m. So if you're done with the operating room early, you just go to clinic, you finish your day there. Once everything is done, we also see our patients in the evening just to make sure that we're up to date with them, that they're doing okay. And, we make our plan for the next day, and then we go home. In addition to all of this, we are also responsible to take call at a hospital. So what that means is that if there were any emergencies that came into the hospital overnight, somebody has a facial swelling, or somebody broke their jaw, or somebody's bleeding excessively from somewhere on their face, we're responsible to go see that patient in the emergency room that night. Usually we take call somewhere between 10 to 13 days in the month. So, during those nights, my phone will be on, the hospital can call me at any point in time, and then I have to go see the patient. There are some nights where I've not slept because I've been in the emergency room all night. And you just have to do that, and then you work the next day, the entire day as well, and it is what it is. And yeah, that's currently what my day looks like. My call responsibilities will decrease as I go along. So as I, go to my increase to my further years of residency, I don't take as much call anymore. So that's one advantage, but that's basically it. And then sometimes on the weekends we take call as well.
Thank you so much, Dr. Natasha Bala, for sharing your amazing responses. The next question is for everyone. Anyone could answer this question, and it is, do you have any advice you would like to offer to aspiring pre-dental students?
I can go. Just general advice, I would say just kind of what everybody's been highlighting is to stay organized throughout the whole process, kind of make a timeline for yourself, starting like end of high school to college, dental school if you want to specialize, just so you apply on time and submit all your applications. I also would say just shadow, probably, again, late high school, junior, senior year, or college, kind of figure out what you love to do, so you have an idea when you start dental school, and so you're just focused and, nothing can kind of bring you down. And then in dental school, I would say do not compare yourself to others, because you'll be probably with like 100 or 130 other people trying to do similar things as you, and just kind of stay grounded and focus, and you should be just fine.
I would add to that as well. I think those are all perfect, and would definitely agree with the once you're in dental school, don't compare yourself to other people. I would add two things. The first is, if you don't get into dental school the first time, don't be discouraged. You know, it's just another opportunity to grow and improve your application. Honestly, I did not get into dental school the first time, and I ended up being an assistant at a pediatric dental practice and falling in love with pediatric dentistry, and now I'm a pediatric dentist. So look for a way, if you don't get accepted the first time, you know, what can you improve? Can you spend a gap year shadowing or working as an assistant, and just apply again. The second thing I would say is, when you're in dental school, you can't pour from an empty cup, whether you're in college or in dental school. So just remember, grades and everything are important, of course, obviously, but you also need to take care of yourself. And sometimes dental school is a little bit like taking a drink out of a fire hydrant. So just take care of yourself.
Yeah, and then just to kind of add to what you guys have already said, it's such a long road. It's a really big commitment of your time as well as your finances. So like the others have mentioned, just getting that experience and that exposure in the field to make sure that it really is a good fit for you, I think is so important, and becoming more and more important as the cost of education continues to go up. I don't think I really fully grasped what that debt was going to look like for me. I was really fortunate. I went to an in-state school, and yeah, my debt was on the lower end of things, and I'm happy to be totally open with you guys about what that sort of looked like for me. I was, I think I came out of dental school around $200,000 or so in debt, and that was with having some help from my family. I borrowed some money from them. And I'm about 5 years out now, and I still, with pretty aggressive loan payments every month, I still have about 7 more years to go in order to fully pay off my loans. And then of course, if you go on to specialty programs, some of those, you know, you pay additional to go to school for a few more years for most of them. The hospital-based programs do pay a stipend most of the time, but that pretty much just covers your living expenses. You typically won't be paying off your loans at that time. So really make sure that you're planning well while you're in school. You know, try to stay on a student budget, which can be really hard. Again, in that regard, don't compare yourself to your classmates, because some people just are not as good at the financial planning. And as much as you can really live like a student for as long as you can will really help you in the long run.
And I guess to just add to that, and this is basically coming from my experience, I spent all of my time in college because I knew from high school that I wanted to do healthcare. I spent a lot of time being very, very stressed out during college that, you know, I must get into professional school. I must. So while I'm not saying that don't take things seriously, I would also say that spend your college time exploring and taking different courses and traveling within budgetary means, and, you know, just enjoying life, because the time to grow up and be serious and deal with loans and everything, it'll come and there's no escaping it, and your responsibilities will just increase. Now, if I need to take a vacation, you know, I have to keep my parents in mind because I want to visit them, and I have to keep my other loved ones in mind because I also want to spend time with them, and then I also have to keep money in mind. And basically, responsibilities, you know, they just increase with time. So have fun and enjoy yourself, and, you know, definitely plan for goals and plan for life, but don't grow up too fast is what I would say.
Thank you so much, everyone, for sharing your insightful and amazing responses. I'm pretty sure that our audience really appreciated all your responses. So now we will begin our live Q&A session. The audience can type their questions into the chat box and our guest speakers will answer them for you. Okay, so the first question in the chat box is, what would you say is the main difference between a dentist and a dental hygienist?
I guess I can take that one since I'm a general dentist. A dentist and a dental hygienist both play crucial roles in the team. They're both providers. The hygienist is primarily responsible for providing cleanings. So they will do basic cleanings as well as deep cleanings, scaling, and root planing. They can give anesthetic and pretty much anything related to the gums and keeping the gums healthy is what the hygienist is responsible for. The dentist can do a broader range of procedures, including fillings, crowns, bridges, dentures, root canals, extractions, and on from there. Hopefully that helps. Hygienists are, a really, really important part of the team, and I have so much respect for them. They do pretty well financially as well, especially here in Seattle. We have a huge demand for hygienists, so if anyone is interested, our office is hiring. But yeah, all right, let's try and catch up. I see a lot of questions coming in.
Yeah, for Dr. Verdin, someone asked, you mentioned something about taking in some pediatric patients in for hospital dentistry. I was just curious as to what that is.
Sure, that's a great question. So in pediatric dentistry, we're thinking about children developmentally from less than 1 to, into their college years and young adult years. So we think about behavior management, and the way behavior management works is on a continuum. So you have, can you do dental work, or is a child medically okay to have treatment in the dental chair? Do they need a little bit of help like laughing gas? Do they need oral sedation? And the last option is hospital dentistry. So kids who are very medically complex, like if they have hemophilia, or, if they're having other procedures done, like sometimes cancer patients, or if they have a heart condition that doesn't allow them to be seen in the office, or if they have cavities in all 4 quadrants and the anterior, we may take them to the hospital for dentistry. So that would mean going to a hospital or sometimes a surgical center, depending on what state you're in, having the child be under general anesthesia so they're asleep. Once they're asleep, we take the x-rays that we need, and then we make a treatment plan. Of course, we give the parents our best estimate of what that treatment plan would be ahead of time, and then we complete the dental work in one visit. Usually it takes between them going to sleep and then starting to wake up about 2.5 to 3 hours, depending on kind of what it is. And they have all their dental work, their fillings, their cleaning, their x-rays, everything done at one time. So that's just kind of one of the options for pediatric dentistry in terms of having dental work completed successfully for the patient.
Okay, thank you. The next question is for Dr. Rowe, and it is, where did you build your network to refer patients?
Yeah, so let me just clarify. Are you asking like where I find patients who come into my office, or where do I refer them out to as far as specialists?
Like when it comes to specialists, where did you find the dentist? Like the oral surgeon or the orthodontist? Where did you find them? Did they reach out to you? Did you reach out to them?
Thanks. Yeah, so a lot of it is location based. I live in Seattle and work in Seattle. And in the city, patients don't like to travel too far. So it's pretty easy to find and connect with specialists in your area. Mostly, I would say, I started at an office that was already referring out to certain specialists, and I think for the most part, they reached out to me and we met in person and got to know each other a little bit better. And then over time, you just sort of get to know their work from referring patients to them. And yeah, I've kind of gotten a better feel of where I want to refer certain patients for different procedures. We do a lot in our office. We have a general dentist who does IV sedation, so we can keep a lot of third molar extraction cases at our office. We also place implants in my office. We do some Invisalign, so we keep a lot of, as much as possible in office. Patients generally prefer that, but there are, of course, cases that we refer out in all of those areas as well.
Thank you. The next question is, what tips would you give for a dental school interview?
So I think some of the things that have helped me a lot with any interviews that I've done is really making sure that you prepare for it. So if that means that you're going to write down the answer to 30 questions and watch how you're speaking those questions, you can use your iPhone or anything else. I think that's very, very helpful. I've noticed that anytime I've actually prepared for an interview and actually listen to how I speak, it makes a very, very substantial difference. I think when I was preparing for so I went to dental school in Canada, and Canada only has about 8 to 10 dental schools. So, my interviews, the ones that I did have, they meant a lot to me. I think I wrote down the answers to about 150 questions and probably spent a whole month and a whole bunch of hours every single day preparing for it. And actually met somebody many years ago who had interviewed me for my Canadian dental school, and they said that they could tell that I prepared, and it made a huge difference. I got an acceptance into my school that way as well. So definitely, you can't underestimate how much preparation actually means. Some people might be like, oh, I'm just talking about myself, it should be easy, that should be like the easiest thing. Yes, it's the easiest thing, but when you actually put thought into your answers, you're not saying things like you have like good answers to whatever the questions are going to be, it does make a difference. And some interviews will just ask you about yourself. Some interviewers will actually put you into situations where they'll be like, you have a conflict with somebody on your team, or you have a conflict with your roommate. How are you going to resolve something like that? So I would prepare for both questions. There's tons that you can find on the internet. You just have to Google it. And also just talking to other people. I remember when I was applying to dental school or residency, I was super, super stressed out. And when I get stressed out, I tend not to talk to people. However, I've noticed that when people do talk to others and discuss answers, they can get so many different, types of responses, and a lot of them can be helpful. So I would also recommend discussing it not with the whole world, but definitely with a few people. And those are some things that I would recommend in terms of interviews.
I think those are all very good points. I would say definitely practicing is the best thing. I say a lot, so I would look at the mirror and practice and make sure I wasn't saying that or doing anything weird with my hands or my face or anything like that. The other thing I would say is before you go for the interview, just go over your CV, your resume, and your personal statement. Because when I was in dental school or applying to dental school, I would get asked about certain things on there. And I remember the first interview I hadn't looked at it and I was so flustered and nervous. So now I just go through that really, really well. And then I would say do your homework, look up if the school has something special about it or something that you're really interested in. Do a little bit of research so you can talk about those points and kind of relate it back to why you would be a good fit for that school and why that school would be a good fit for you.
Okay, thank you very much. The next question is, I recently applied to dental school. Any tips on what to do about the stress and anxiety of waiting to hear back?
Oh my gosh. I think we all remember that time. But I think just really stay positive. Try not to fixate on the whole thing. Once you submit, you just have to really be hopeful because you put in all of your hard work and effort. So at this point, you can kind of just focus on other things, again, stay positive, focus on yourself, and then always have like a backup plan. So what would you do if you didn't get into dental school? Maybe work somewhere, do like research at an office. So just stuff like that. Always have a backup plan and just really, really stay positive and hopeful.
I would like to say that I did this when I was applying for residency, but that would absolutely not be correct. But this would be my recommendation. Um, Trying to just basically, keep yourself really distracted, doing things that you actually enjoy, surrounding yourself with people who you enjoy spending time with, so it can keep your mind off things. If you enjoy exercising, do that. You might also have to force yourself to do all of these things, because the natural tendency is to check your email 50 times a day, which is exactly what I did, or try to go and apply to more schools, which is also what I did. Every time I would submit 10 residency applications, within 2 or 3 days, if I didn't hear back, I'd submit another 5 residency applications to 5 other schools. So, if you do all of that, it's not completely unheard of. However, just keeping your mind off of it, however you can do that, is kind of similar to what's already been said, is what I would say you should try to do. But it's normal to feel anxious. I'm sure all of us have felt that way before.
Okay, so the next question is for Dr. Bala, and is what types of things did you do to improve your application to get into dental school?
So I guess it would depend on where you're applying to. So I went to, college in Canada. I also went to dental school in Canada. However, I did apply to dental school in the United States as well. Canada is very, very academic based. So they didn't even ask me to submit what extracurriculars I had done. They didn't care. They essentially just cared about what my grades were and what my DET score was. And the United States cared a lot about what I did outside. They wanted to get to know me as a person, and not just so much my grades and my dental school, or my DET. So I guess a lot of schools did not care about which 2 years I did the best that I could in. All they wanted to average my GPA out for my best 2 years in undergrad. So I didn't have to do an extra year in order to, have a great application. I was luckily able to achieve that in about 4 years. However, if you need to take an extra year to improve your grades, it's not the end of the world. You'd be surprised when you get to the specialization level or even dental school. A lot of people have taken a couple years to achieve whatever their goals are. Life doesn't end when you're 30 or 28 or whatever. It's a very long road. So if something takes a little bit of extra time, I wouldn't shy away from doing that. If you are applying into a region that really cares about extracurriculars, I would say that you don't have to apply to 10 extracurriculars and be engaged in 10 extracurriculars. You just need to do maybe 2 or 3, but actually be really passionate about it, so much so that when you're talking to people who are interviewing you, they can see how excited you are to talk about this, because your excitement will be very infectious to them, and they'll feel excited by you. They'll associate you with a lot of positive feelings, and that's more likely for them to remember you amongst the hundreds of applications that they've gone through, and more likely for them to send you an acceptance. So just a few extracurriculars. If you need to take a little bit of extra time in order to strengthen your application, that's perfectly fine. I took the DAT, the Canadian DAT, and the USA DAT. I don't know if you can take it a couple of times and then they take your best score. I'm not sure how that works, but if you can take it, I know for other exams, it does work that way, that you can take it a few times and they just look at your best score. So if you need to do that, do that. But, I just don't feel defeated if things have not worked out in the first go for you. Just kind of look at what is lacking in your application and work towards that. And that's what I would say.
Okay, another question is, I want to get my dental assistant license, but I am not sure whether I should go to dental assistant school during undergrad or in the summer.
Yeah, so there's several ways you can go about training to become a dental assistant. Some people train on the job, and I think this may vary by state, whether on the job training is acceptable in order to get your dental assisting license. But I know here in Washington, it's a lot to learn though. So I would say most people do programs. And I would say when you do it will really just depend on your schedule and the structure of the program that you choose. So really just look at what your schedule allows, and if it's a full-time program, can you balance that with your school, or is it something that you would want to take separate time to do?
Okay. So the next question is, would you say that you can work a part-time job while going to dental school?
I would say that's from my experience, that's 100% definitely a possibility. I think that having a second job actually forces you to be more disciplined. It forces you to streamline your life a little bit. So I think it's definitely possible.
I would say it is possible. I didn't have I babysat and things like that, like little odd jobs. But I didn't know if I could necessarily work like a full-time job on like a Saturday or weeknights. I think you have to look at how you work best and how you deal under stress, and realize that there's definitely benefits to having a job, like extra income. But there's definitely also stressors, especially in your first year when you have a lot of didactic classes and a lot of exams. So I would say it's definitely a possibility, but I think you also should be realistic about how you handle stress, how you organize your time, and kind of what's important to you before you decide. And I would take a few months in dental school at first just to kind of adjust and get used to everything before adding in a job on top of that.
Okay, thank you so much. Unfortunately, that is all the time we have for today, and I hope the audience and our panelists enjoyed this conference. Make sure to follow us on Instagram, and our social media handles are right there. And to learn more about upcoming conferences and opportunities. If you would also like to join our team, you can fill out the team application where and the link is in our bio. And yeah, so thank you so much for joining, everyone. Have a great day, and thank you so much to our panelists for taking time out of their busy schedules to be here. Thank you.
Thank you.
Thank you, guys.
Bye. Take care.